why some people have major problems, other people don't. Some people get better fast. Some people, they have problems for the rest of their lives with their neck and whiplash and headaches and vertigo and dizziness and all the things like that. So whiplash is when the head goes quickly and forcefully back and forth like that. Most commonly, it happens from rear-end car accidents, also from sports. So I've had it twice. Once from surfing, like falling and my head snapping back, and then once from hockey, somebody fell on my head and forced my head forward. So I'm interested in it because I have had it, and I did have weird symptoms when I got it. The second time I had whiplash, I had skin hypersensitivity for like a month, where like the sheets on my bed were like burning when they touched my skin. So it was affecting my nervous system somehow.
Eric,
yeah.
Are you going to explain to everyone what happens to the tissues, the muscles, the connective tissues when a whiplash injury?
I'm going to, a little bit.
Love it.
That's next. Whiplash injury is the most common condition in motor vehicle accidents. I guess the most costly to the medical system and insurance companies. That's where Kurt comes in. and me. Millions of medical publications on the topic, yet the exact cause for the symptoms people experience is still poorly understood. So you can do X-ray, you can do MRI, you can do CT scans, but those images don't really tell the full story in detail. They just don't show like small tears, partial tears. They don't show like movement dysfunction and subtle things like that. Here is an example. If you take a cross section of the spine from the side, that's kind of like that. Cut it in half. Just to show some of the ligaments. So ligaments, there are ligaments between all the bones in our body. And here is an example of, I don't know if you can read it. The purple is a ligament that runs along the back of your spine. The body's up the spine. Then you got the blue, another ligament. The green is another ligament. Yellow, so these are all kind of going here, between these bones here, between here, and ligaments are not really designed to stretch that much. They're supposed to keep everything kind of stable. So when you forcefully stretch a ligament too quickly, the ligament will stretch and tear a little bit. That will create inflammation, and then if it stretches enough, you can get an instability in the neck. But you want your neck to be stable. Like a lot of people do core exercises for their low back. Your neck, actually, you should be doing exercises for that too. So there's kind of like a core exercise thing you can do for your neck that keeps it strong and keeps your spine stable and tight, because that's what you want. You don't want instability in your neck or low back. So ligaments get stretched, ligaments get damaged in whiplash. Next, you see some more ligaments. Here's just another diagram of different angles from the spine. There's so many different ligaments in our spines. Most people who suffer a whiplash injury experience a gradual improvement. 3 months, a lot of the time people get a lot better. There are a lot of people that are permanently, they have like chronic issues for the rest of their life. So my goal when people come to me is to make sure that they don't get chronic issues. That's the way I think. Like everyone that was in a car accident, I tell them that in the future, even if it's not bad now, it could become bad later. And we don't know who will become bad or not, so we better just get in there and do as much as we can do. Alright, so, what's this? Blah, 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 blah. This one.
Eric, can you show the spinal cord in that model you have?
The spinal cord?
Show that to everybody. So they know.
Spinal cord is the yellow orange thing. That's the spinal cord. And then the nerves come out of the spinal cord through the holes in your spine, right there. When you herniate a disc in your spine, what happens is the disc bulges and goes and hits the nerve. You can see that. The yellow thing is the nerve.
And that's the pain, where the pain is.
And then you'll get sciatic pain like running down your leg. Or if it's in your neck, you'll have pain running down your arm into your hand, or numbness or weakness. You'll have nerve issues. All right, fun facts about whiplash. You can be going just 5 to 10 miles an hour, right, Kirk?
That's right.
It can be a very low, slow speed can still give you a trauma, especially if you're not expecting it. So whenever you're not expecting something and your head goes back and forth, that can be traumatic because your head weighs a lot. It's like, I forgot the exact pounds. 9 pounds, I think? It's like a bowling ball. It's a bowling ball on top of your head. And if your neck is not ready, you go ding, ding, your head is heavy and it'll tear something.
And when you have acceleration or gravitational forces put on your body and your head and neck, and Eric knows this, your 8-pound, 9-pound head can turn into a 24, 34-pound object. So therefore, it does do a lot more damage and there's tears and damage is time.
Yeah. Whiplash is a soft tissue injury. It's hard to detect on x-rays. I kind of talked about that already. 85% of whiplash injuries are caused by car accidents, rear end accidents. We talked about that. Symptoms can be delayed. So this is another big one. A lot of people don't feel anything right after a whiplash. They feel fine. They're kind of in shock. They have adrenaline. It takes like 2 to 3 days a lot of times for the stiffness to come up. And even then, it's not that bad. It's like maybe the neck is stiff. Then in the next couple of weeks, it can start to become more painful. So, women are at higher risk because they have weaker necks. And the reason I got whiplash is because I have like a big head with a long neck. So it's like it's a lot of force. So your anatomy has something to do with it. Whiplash can cause 20 to 50% of people with whiplash report chronic issues for months or years. This is known as whiplash-associated disorder. Children can get whiplash too. It's really important that children get treated after a car accident. Because a lot of people I talk to in my office that have neck problems or chronic headaches, I always ask them, were you in a car accident ever? When you were a kid, it doesn't matter when, were you in one? And they always were. Always. I swear that's true. Whiplash claims make up to 70% of auto injury claims, costing billions. Whiplash can happen in sports, falls, physical abuse, roller coasters, etc. And that's it. Anything I missed, Kirk?
Well, just tell everybody why someone who has an auto accident 10 years ago still may be having neck issues. Why does it get chronic?
Because when your body wants to repair itself, when there's been like a damage to the muscles or ligaments or tendons, your body repairs itself. And the way it repairs itself, it kind of puts like extra tissue down. And then all the muscle will get stuck together because of the scar tissue as part of the repair process. And that will create this stiffness around your spine. And that will remain until you consciously go in and break it down. That's why, I don't know.
I have a question. It's kind of for Kirk.
Yeah.
Heretofore, whiplash was looked at with
Disdain.
disdain.
Because you can't see it.
Yeah. Has that changed?
In my opinion, yes. Insurance carriers still discount it, but I still haven't got that perfect case to take to trial where you just have a low impact with chronic pain. That's something I'm willing to try, but the economics don't make sense because you're going to spend a lot more money than the case is worth potentially. So it makes sense to settle that case usually, but again, the right case, the right plaintiff comes around, and if Eric's the chiropractor, we probably have to bring on a medical expert to testify, also an orthopedic surgeon to testify about chronic pain that would corroborate what Eric would be saying. But yeah, I think it's gotten better.
Who looks at it with disdain? The insurance company?
I think the public and the insurance companies,
Yeah,
right?
because it's whiplash, really.
Yeah,
Right?
whiplash, yeah.
Really?
It's also fake
Always
insurance.
excuse, right?
Yeah, it's fake because you're not.
Like you're trying to scam the insurance company?
Yeah.
Oh, that's
So
crazy.
you have
That's
to really
that's
good
wrong.
proof. Lots of studying, imaging studies,
It's
and
definitely real.
documentation. Yeah.
How long do symptoms start after an accident? Because they
Usually
usually don't start right away.
in
right?
2 to 3 days, I find. It could be immediate, a lot of times it's 2 to 3 days.
Okay.
Yeah, that's what I found. Yeah.
Interestingly enough, I have a felony hit and run case that I tried to criminal defense to, and it's involuntary manslaughter, no gross negligence. So my guy was not drunk, he was driving the speed limit. Someone crossing the street at night in San Clemente, victim died, and he can't remember the incident at all. So there's this whole thing with the prosecutor, and I had him do an MRI right after, like 7 days after the accident, and it doesn't show anything. But we had to get a neuropsychologist involved in the whiplash because he had prior sports injuries. The whiplash he got caused a traumatic brain injury to him that was like exponentially worse, even if it was, not as strong of an injury. So it's this whole thing where like the DA won't give us anything. Oh, that's, we don't believe it. MRI didn't show anything. I'm running into this big roadblock. So even from a criminal standpoint, like as far as a defense, like
I would say the same thing if I was on the other side. If I was an insurance company, I'd say, yeah, we can't see it.
Right. So it's just interesting.
I would
Really
say-
any
yeah,
area.
I'd say the
So
same.
at the ER, I always diagnose it, but they don't have neck pain necessarily, but you can see the straightening, because
Yeah.
there's a natural curve.
Yeah, I didn't
So
talk
the
about that.
muscles are gonna be straightened, and usually after I let them sit there for hours,
Yeah.
they start to stiffen up and they start to feel it.
Yeah.
But you
I
should
didn't
be
talk
able
about
to
the curve.
document
Yeah, I
it.
just forgot about that. Yeah.
One more.
Yeah, one more.
So, and this is a weird question, but is it baby syndrome, is that a similar action that happens?
I don't know.
Because it would be like,
Neither
their
probably
head is
seen that.
heavier, in
It's gotta be
proportion to their
similar.
bodies.
What happens with that?
I was gonna ask you, what's the youngest age you'll treat? Did you
Yeah.
newborns?
I don't really have probably like 12.
Well, you know that whole thing about when you give birth to the baby in the neck and.
I don't mess with babies.
Just curious.
Maybe they need it, I don't know, but.
In case I have a baby in the next 9
I don't want a
months.
baby in my office.
No.